So long head of the tricep brachii, okay. Lateral head of the tricep brachii, okay. Tendons of the tricep brachii, okay. Medial head of the tricep brachii, okay. Olecranon. So olecranon process of the ulna, and this is radius and this is posteriorly. Showing from us that is rise straight. So dissection cut through the muscles arising from the lateral and the medially epicondyles of the humerus and reflect them distally, if not already done. Also cut the bicep brachii, brachialis, tricep brachii 3 cm, proximal elbow joint and reflect them distally. Remove all the muscle fused with the fibrous capsule and the elbow joint and define its clinical atomic distension of the elbow joint by exfusion occur posteriorly because here the capsule is weak and the covering deep fascia is thin. Yes. Aspiration is done posteriorly on any side of the olecranon process. What is aspiration? What do you mean? Comment in. I will discuss in the next video. So clinical anatomy are just distension of the elbow joint. Distension means side on a, we can say, capsule effusions. Yes. So dislocation of the elbow usually posteriorly and often dislocated with a fracture of the coronoid process. Triangular relations between the two humeral epicondyles is lost. Yes, real. Subluxation of the head of the radius pulled elbow occurs in children when the forearm is suddenly pulled in pronation. The head of the radius slips out from the annular ligaments. Tennis elbow using occur in tennis players. Yes, this is in tennis elbow. In its effect individual these with involve repetitive wrist extension against the resistance and twisting activities. This is possible due to sprain and of the radial collateral ligament, tearing of the fibers of the extensor carpi radialis brevis. Recent research have pointed out that it is more of a degenerative condition rather than inflammatory condition. Student minor elbow. So this is the student minor elbow. So it is characterized by effusion into the bursa over the subcutaneous posterior surface of the olecranon process. Students during lecture support their head for sleeping with their hands with flexed elbow and the bursa on the olecranon get inflamed. Golfer. This is the golfer elbow is the micro trauma of the medial epicondyle of the humerus occur commonly in the golfers. Common flexures origin undergoes repetitive strain cause result in painful condition. Carrying angles can normal 13 degrees more than the condition is cubitus valgus and ulnar get the stress leading to weakness and tendency muscles of the end angle. The tissue called so this is the axis and this is the cubital valgus and this is the normal.